what happens during a tummy tuck? So a tummy tuck, which is also known as an abdominoplasty, is designed to contour and shape the abdomen, whether after pregnancy or after significant weight loss, with the goal of removing any excess skin, fat, and repairing and tightening any weakening of your abdominal muscles, what's known as erectus diastasis, which can weaken or spread apart over time. And there are different kinds of tummy tucks. And the goal of this at the end is to have you a nice flatter abdomen that's more contoured, that has nicer shape. It should be known that oftentimes it will do liposuction, especially of the sides, at the same time as a tummy tuck, to kind of bring patients in even more and more much nicer. So there are different kinds of tummy tucks. In the classic, or what's called as a full tummy tuck, we make an incision from hip bone to hip bone, and that is the incision we use to basically remove any excess skin, any excess fat, and things like that. Now, in an extended tummy tuck, what's the difference between extended and full? In extended tummy tuck, you just go further towards the back. It's just a longer incision, and that tends to be designed for patients who have more significant weight loss and things like that, who have laxity that goes all the way to the back. Now, in a mini tummy tuck is for patients who generally just have laxity or loose skin that's below their belly button or the umbilicus. And in those patients, we can just make it what's typically a little bit of a smaller incision. We may or may not do muscle tightening in those patients, depending if they have it. If we do muscle tightening, it's obviously just below the belly button. And we'll actually get into the belly button in a second, because that's a common question, is what happens to the belly button in a tummy tuck? Lastly, you'll hear something called a fleur-de-lis tummy tuck. That's for patients who have excess in both vertical as well as horizontal dimensions. So they have excess in this way as well as this way. So a standard tummy tuck is not going to involve their excess. So they will actually have an incision this way as well as this way, sort of in the shape of a T. The incisional here is to remove the excess in this dimension. The incision here is to remove excess in this dimension. That's your fleur-de-lis. Lastly, you might hear something called a reverse tummy tuck. Those are for patients who have laxity above the belly button. In this case, we actually make an incision above under the chest or the breast to lift things up. Now, what happens to the belly button? So in a standard typical tummy tuck, at the beginning of the surgery, I will incise around the belly button, dissect it free, and then leave it there. Then I will dissect, lift up all the skin. At the end of the surgery, after I remove all of the excess skin, I'll actually make a new hole for the belly button, and I will bring the belly button back out. So it's the same belly button as before, just the shape will be differently and the way it looks, and the positioning may be slightly different than it was before. It won't be hugely different because, again, it's been kept in place in the belly button. It can only travel so far, and I would only really move the position to make it look better, to make it midline or more centered or whatnot. So those are the different kind of tummy tucks. If you have any questions or comments, you can either comment below, you can DM me, and if you want a consultation, you can also follow the link in my profile above.